Hello everyone, welcome to another episode of the Health Tech News brought to you by Medix in Tech. This is your go-to channel for everything health tech happening globally, and I'm excited again to be your host for this episode. So, I have interesting updates for you as usual. If you have been missing the previous episode, do well to go check it out. Let's go right into what I have for you for today's updates. First on the news is an update from Airtel. Airtel recently partnered with the Mobile Health International to provide affordable digital healthcare services to Africans. Under this partnership, Airtel users across Africa can now have access to quality healthcare via the Mobile Health Telehealth app that goes live on the Airtel network. Airtel, could this be a compensation for the recent hike in data tariff and plan? Well, that's up to you to judge. All right, so back to the news. First comment is from Fumi Adewara, the CEO of the Mobile Health International, who said that the partnership with Airtel is geared towards bridging the healthcare gap by leveraging telemedicine technology. Let's take other comments from her. According to Adewara, the partnership will allow people to consult with licensed doctors, receive prescriptions, and get referrals from the comfort of their homes, whether in bustling cities or remote rural communities. Also, there's a comment from Femi Oshinada, the Chief Operating Officer of Airtel Nigeria. He said, Airtel has always been at the forefront of providing innovative solutions that improve the lives of Nigerians. That's up to everyone to accept anyways. Let's go back to his comment. Also, according to him, partnering with Mobile Health aligns with the telco's vision of bridging the healthcare gap through digital transformation. Now, our customers can prioritize their health without barriers. Oshinada also mentioned that the benefit to Airtel subscribers includes access to doctors globally with affordable subscription plans from 5,000 naira per year. So, Airtel subscribers, you all now have something to bank on, to be comforted with. MTN, I'm waiting for you guys. And that's it for the partnership between Airtel and the Mobile Health International. Guess what I have next on my list? Something big. All the way from Nigeria. Let's unveil it. Federal Government of Nigeria launches an app called the Brand App to support cancer treatment. As part of efforts to combat breast cancer in Nigeria, the federal government, in partnership with Rocky Nigeria and OncoPadi, has launched the Breast Cancer Access Navigation and Testing Brand App. Now, this initiative aims to enhance patient care, streamline support systems, and empower individuals battling the disease. The fact that this is coming from the federal government of Nigeria makes it more interesting for me. The launch of this app was done in partnership with OncoPadi and Rocky Nigeria. Let's take a few comments from some personalities present at the app launch. Let's start with a comment from the Director General of the National Institute for Cancer Research and Treatment, Professor Usman Aliyu. He described Brand as a significant step in the country's effort to enhance patient care and streamline support systems. He also emphasized that the app will also empower individuals battling breast cancer, offering them better access to resources and guidance throughout their journey. We have another comment from Dr. Usman Waziri, the Director of Cancer Prevention and Control at NICRAT. Dr. Usman explained that Brand was designed to make navigating the complex landscape of breast cancer diagnosis and treatment easier by connecting patients, healthcare providers, support groups, NGOs, and civil society organizations into one unified system. We also have a comment from Dr. Omola Salako, who is the CEO of OncoPadi. She highlighted the shortage of oncologists in Nigeria, with fewer than 95 oncologists nationwide, particularly in rural areas. She stressed the need for technology to bridge the gap, allowing oncologists to reach patients across the country. To the last comment, this is coming from the Managing Director of Rocky Nigeria, Dr. Bolariwa Oyedeji, noted that the initiative would help close the gap in cancer care by providing patients with guided navigation from diagnosis through treatment. I'm looking forward to not just the implementation of this, but the sustainability of the program and how it's really going to help cancer patients in Nigeria to easily gain access to healthcare. So yeah, really looking forward to it. Now let's move to the next news for today. Next on the news, Cylinder Healthcare has acquired the Data Health to add AI-powered stool imaging app. This is quite impressive, and I really would love to know more about how this stool imaging app works. Okay, let's get into more details about this new acquirement. Cylinder Healthcare is a virtual digestive health provider, and it has acquired the Data Health company, which developed a clinically validated AI-powered stool imaging app. Now, let me tell you what is unique about this whole acquirement. Traditionally, patients with gastrointestinal conditions are often asked to observe their stools and report the outcome so that it can influence diagnosis and treatment decisions. But now, with the Data's app, healthcare providers can capture stool photos with smartphones, then classify the stools with 5 clinically validated data points. According to the company, the technology has outperformed traditional patient-reported outcomes and has been validated through 4 peer-reviewed studies, including research from Cedars-Sinai and Mayo Clinic. Data has hundreds of thousands and stool images associated with a diverse set of diagnoses and clinical context on individuals. Their efforts have already yielded promising results in areas such as IBS treatments, ulcerative colitis monitoring, and cirrhosis management. So integrating this AI into Cylinder's platform will provide faster, more accurate insights into GI conditions, enabling earlier diagnosis and tailored treatment plans. Now, let's take a comment from the CEO of Cylinder Company. According to Bill Cinder, the CEO and founder of Cylinder, integrating Data's AI-driven stool imaging directly supports our mission to improve digestive health outcomes and member experiences. This acquisition enhances our AI capabilities, opens up new clinical opportunities, and reinforces our commitment to innovation in digestive health. The fact that this is helping healthcare workers to provide better services and cut down turnaround time in giving patients proper diagnosis is what makes it unique, special, and super amazing. This is why innovation excites me. And of course, I still have more for you in today's updates. Now, let's get right into the next news. Next on the news, the American Cancer Society, ACS, and healthcare AI company, Leia Health, has linked a multi-year collaboration to use large language models to speed up cancer research. Now, traditionally, getting information from patient records for research takes a lot of time. And of course, it is labor-intensive, which relies a lot on human efforts. With this partnership, the ACS will now use Leia Health's innovative large language model power data abstraction platform to extract clinical data from thousands of medical charts of patients enrolled in ACS research studies. According to reports, the collaboration builds on a successful pilot involving breast cancer patients. With Leia Health platform, the ACS will be able to pull complex concepts from patient charts with an accuracy of 95 to 100% on all pilot variables, beating human performance. This accuracy is quite impressive. Now, let's take a comment from Alpa Patel, the Senior Vice President of Population Science at the American Cancer Society. We're excited to work with Leia Health to streamline and scale our data abstraction process. This collaboration will help us accelerate our research and generate more meaningful insight that can drive progress in the fight against cancer. The second news about cancer today, and it's amazing that cancer, which is one of the leading cause of death globally, can now be tackled using digital innovations. Right, let's go to the next news. I can't assure you if it's not going to be about cancer, but let's see what it entails. This next update is quite an interesting one. Trust me. So, let's just dive right into it. Lombard University has developed an AI model aimed at tackling healthcare challenges faced by people with learning disabilities and multiple health conditions. This AI model is currently being applied at Leicestershire Partnership NHS Trust. Now, this is the interesting part of this innovation. According to a team that has been working on this Decode project, the model has the ability to predict how long a person with learning disability is likely to stay in hospital, and it aims to improve care and resource planning. The fact that an AI model can predict how long a patient can stay in an hospital is something really unique. And I believe you agree with me. Okay, there is more information to this. The AI model was trained in general practice and hospital data from over 9,600 patients with learning disabilities and multiple health conditions in Wales, and was then used to analyze key data to help identify reasons for hospitalizations and health patterns among people with learning disabilities and multiple health conditions. Also, the researchers have highlighted that this model is 76% effective in distinguishing between patients that is likely to stay long in the hospital and those who would be discharged sooner. This is impressive. Yeah. Really. Of course, there's a comment about this, and it's coming from Dr. Satish Gangadharan, who is the consultant psychiatrist with Leicester Partnership and the Decode co-principal investigator. He said, "We're in the process of applying this knowledge into practice as well as sharing it widely. While hospital care is an important part of healthcare provision, we're exploring ways to minimize the need for hospitalization by exploring where health interventions could be delivered earlier and people with learning disabilities could be engaged in their care better." Interesting. Now, we've been following the news. All these innovations that I've been talking about have one thing in common, and that is to reduce the number of patients that visit the hospital for services. So at the comfort of the patient's house, the patient can see a doctor, get their diagnosis, get their prescriptions done, and all of that. This is why I kept saying I love innovation, because now doctors and other healthcare providers can have more time to invest in carrying out more research to provide better services to patients' care. That's it for the news today. There's been lots of innovations happening this year in the world of health tech, and I don't want you to miss out from any of that. So ensure you follow our previous episodes if you're yet to do that. And if you're watching these episodes, ensure you are subscribed to this channel and your notification bell is turned on so you don't miss out on all of the updates we are bringing to you. Thank you for joining me on today's episode. I remain Glory, your host, and I'll be looking forward to seeing you in the next episode. Don't forget to leave a comment for us if you find this interesting and impactful. See you next time. Bye.